Well, hi there, folks. Welcome to the program. This, of course, is Stinchfield, the podcast. So I've got to ask you, what in the world is President Trump doing? I mean, I thought he was on board with RFK Jr., kind of pushing back against all the vaccinations, especially the COVID vax. Now, I know that President Trump has deep ties to Operation Warp Speed. He had looked at that as a great accomplishment. I understand from his perspective why it would be so hard to acknowledge that it didn't work out the way he wanted to. I believe he was lied to along the way from those inside the CDC and the FDA. But now, as you see on the screen here, you got the letter where he got the COVID booster. It's not working. And even worse than that, as you can see by the numbers there, it's also causing great harm. In 2025, according to the VAERS report, 394 booster deaths. So does this mean we need to be on cancer watch for President Trump that he's getting these boosters? Maybe. I want to talk about that. What's behind Pfizer coming into the Oval Office? It's all kind of disappointing from the guy that I still love and who still has my 100% support. But if I was face to face with him, I would try to talk him out of going down this road. So this podcast, as you know, is brought to you by the Wellness Company. TWC.health/grant. Use the promo code GRANT. And again, folks, my main goal in life is to make sure you're always prepared. Prepared with knowledge, prepared with making sure you have the ability to defend yourself against anything, and prepared for an emergency, like having prescription medications on hand. This is the Wellness Company's prescription medication kit. There's 8 of the most common prescription medications you and your family would need in here. Super easy. Just go on the website, fill out the form. A doctor will call you, make sure it's just right for you, this kit. TWC.health/grant, but you'll have it on hand. So if a kid gets strep throat, you can hit him with the amoxicillin. If something happens where you need antibiotics right away or antivirals or ivermectin is in that kit, you will have it. TWC.health/grant. And don't forget, folks, about the parasite cleanse. I think it's so important. I went through this detox of the parasite cleanse from the Wellness Company, and I feel like I've never felt before. Mebendazole and ivermectin sold out 3 times. Get these parasites out of your body. The more I read about this, the more I knew I was going on one of these total body detoxes, and I did, and I thank the Wellness Company for it. TWC.health/grant. Use that promo code GRANT for 10% off. All right, with that, folks, let's get the show started.
Uncensored and unapologetic. This is Stinchfield. Here's your host, Grant Stinchfield.
All right, folks, it's not just me. I want to bring in an expert on all these topics, especially when it comes to the vaccine, Dr. Ben Tapper. He's the director of epigenetics with the Wellness Company. Dr. Tapper, it's always great to see you.
Grant's good to be here. Thank you.
All right, I'll ask you the same question I asked myself. What's President Trump thinking getting this booster shot? We're now on booster 272. Why? It's not working.
Right. It's comical to me at this point, but I think, Trump's true colors are showing here. And I hate to say that, but you have to go back to 2020. He struck a deal with Pfizer that allowed Pfizer to profit over $100 billion on the vaccines with Operation Warp Speed. I mean, they made a $1.95 billion deal back in 2020 prior to the pandemic with the emergency use. So this is nothing new here. So we have to keep a keen eye on this. But again, I think, a week prior to Trump admitting that he got the vaccine, he has the CEO of Pfizer in his office saying, hey, we're going to strike another deal here and allow Pfizer to invest in this whole thing. And so it's corrupt at most.
Let me play this clip. This is the CEO of Pfizer in the Oval Office talking about this deal that they have struck.
We are ready to invest, as the president also mentioned, $70 billion in the next few years from Pfizer in manufacturing and research in America alone. I really think this is an historical moment because also I can put that behind us and focus on the things that I want to spend my time, cancer treatments, to bring better obesity medicines, to bring better vaccines, to bring things that people value. And thank you for allowing us to do that. I want to...
Before I play some more of this, as I'm listening to it, Doc, I'm thinking to myself, oh, geez. First off, cancer treatments, I think literally all they want to do is make money off of cancer. I'm convinced they don't actually want to cure cancer. Obesity, which I know they're making money off all the Ozempics and stuff, which is not good for you. I mean, your muscle mass just gets eaten away by these things. And then, of course, vaccines. So the three biggest money makers are the first thing out of his mouth in the Oval Office.
Right. I mean, again, they don't want to cure it. They want to manage it. Like you just said, they don't want to cure disease. They want to manage disease. And it's all about big profits. I mean, the cancer industry is a multi-billion-dollar industry. The vaccine industry is a multi-billion-dollar industry. I mean, and really there's no money in the cure. And so that's why, you know, they're partnering with these pharmaceutical industries, these giant empires to further along this $1 trillion industry that they have. They have a stronghold on healthcare and they have a monopoly on our healthcare system, and it needs to be broken. And again, we need to wake up to the corruption here.
All right, let me play a little bit more of him and get your response.
Thank Secretary Kennedy. I want to thank Secretary Latnik. Your leadership helped us to pull that together. You are the mastermind of everything, and without the brilliant way that you designed the whole thing, you wouldn't be able to make it happen. But you were even more brilliant because you had someone in your team that he was the driving force behind everything. And
honestly, it makes me pretty angry to watch to me, look, is there anything redeemable about Pfizer? They've got to make some drugs that are decent, right, Dr. Tepper? Please tell me they do.
I mean, medicines can be life-saving. There can be absolute medications that can be life-saving, absolutely. But Pfizer has a track record. They have a history of corruption. I mean, look at they settled in court for one of the largest medical fines in U.S. history, a $2.3 billion deal for bribing over 4,000 physicians and politicians to lie to the people. They settled in court in Nigeria for testing pharmaceuticals on children in Nigeria without the parents' consent. And I'm a capitalist. I'm an entrepreneurial through and through here. But what we're witnessing here is Pfizer is in bed with our government, which is the very definition of crony capitalism, right? And now you're going to see, I make no mistake, legislation to favor big pharma even more, and you're going to see more mRNA technology coming down the pipeline. And we need transparency here. People are screaming at the rooftops. We need accountability. We need transparency, but we're not going to get that if they keep furthering deals with Pfizer, the very industry that is pushing all this garbage down our healthcare system.
All right, so he's hugging Dr. Oz. Dr. Oz, I probably could see it from, right? Like, I don't think he's like the biggest conservative in the world. He lost the Senate race in Pennsylvania to John Fetterman. I mean, if you couldn't beat Fetterman at the time, I don't know. He seems like a nice guy, Dr. Oz, but all right, I see him, the hugs of Dr. Oz. He goes out of his way to thank Secretary Kennedy. Now, I know R.F. Craig Jr. has got to be holding his nose through this whole thing. He had to be one to tell the president, please don't get the booster shot. Am I right?
I mean, I would like to think so. I mean, Bobby Kennedy has been at the forefront of this, stance, trying to bring transparency, especially around the corruption on the vaccines. But again, I pray that, he feels that way. And I pray that the truth does come to the forefront. Again, I don't know what the play is here with Trump showing that he got his vaccine status. A lot of people are confused. And they're wondering why, at a time, especially a crucial time when we're like, okay, finally the truth is going to come out about the vaccines. The truth is finally going to come out about the mRNA technology and how many people have been injured. And we have more injuries in the VAERS reporting system in the last 4 years than the whole 30 years combined. So there needs to be some transparency here. And we're at a point past debate. We're at a time where there should be, trials here. Crimes against humanity have been committed. And the people are awake to that, and they're fully aware. So the fact that Bobby Kennedy is still staying silent, to me, that's complicity. If you stay silent in the face of evil and corruption, you're guilty of complicity.
Now, I will say this though: going to work for the president of the United States, no matter what party you are or what president it is, it's somewhat different. You're making an oath that you are going to support that president and his policies. You're working in there, and it's not like you work for a company and you're going to speak up or you've taken an oath now. Yeah, I'm going to back you. And if you don't want to back him anymore, then you got to leave the office. But there's plenty of things and plenty of people that probably disagree with President Trump on certain things that have to stay quiet because you've taken and made an agreement with the president. You're there to support him. And so I don't know if that gives him a pass on all of this or if maybe he should just quit and then speak out. But you can't speak out while you're in the administration.
Right. I mean, again, going back to transparency, I just feel like there's so much confusion of where Trump stands on this because, he still praised the Operation Warp Speed again, and Kennedy there's actions against, the ACIP. Obviously, we saw a turnaround and transition the ACIP. We saw a lot of people getting fired from the CDC. He's working now with William Thompson, which was a head whistleblower of the CDC back, over a decade ago, came to the forefront and said, listen, they're tailoring studies, they're doctoring studies to show desired outcomes, to hide the fact that vaccines are causing autism in African Americans. So he's working with William Thompson. So I am hopeful there. And I pray for some of this transparency to come to the forefront. But again, we need it now more than ever.
I think you've got to take a realistic look at where Bobby Kennedy is and what he's got to balance in order to get the overall job of what he wants done, and that's transparency and reform. And we're already starting to see that with the vaccine schedules being changed around. And look, President Trump signed this executive order. This was pretty big.
This first executive order, it prohibits federal funding for COVID-19 mandates, vaccine mandates in schools.
Okay, and that will meaning they want to clear that up,
Yep.
the discrepancy.
So any schools that require students to be vaccinated with COVID-19 shot, then there's no more federal funding. So.
Okay. Okay, that solves that problem.
Mm-hmm.
So, I mean, that is a big one. It is interesting.
Right.
Part of me thinks, I don't know if this is really the president's issue. He is older. I see with older people, the vaccines, they're quick to trust medical establishment. I don't know if that plays in a role. It's like in the beginning, he really didn't even know what he was signing, right? I mean, that kind of was put across, and I know he's good with it, but what'll that do? Oh, well, if you're mandating vaccines, you're not going to get federal funding. So that cuts off schools from mandating vaccines. That was a big one, Dr. Town.
Right. I'm thankful for that because how many students were denied access? How many students got kicked out because they refused the vaccine? I know a lot of people that were in nursing school, especially, they got kicked out. They couldn't graduate because they refused the vaccine. So that to me was great. But we have exemptions in every single state. Every single state has medical, religious, or philosophical exemptions. I mean, there's 3 states that don't have a religious exemption, and these schools should be honoring those exemptions. Mm-hmm. And so to me that's law. If they are not accepting those exemptions, then they're in violation of that law. But I'm very thankful Trump did sign that. Absolutely.
It seems to me like they do everything they could do to not recognize these legitimate exemptions,
right,
including religious exemptions. They just despise that. It seems like everybody in education has kind of turned its back on God and religion and all of those things and shun it, Doc.
100%. 100%. The only thing that justifies a religious exemption is a sincere belief. And that's all you need. And so you get a lot of, these entrapment cases where like, well, what other medications are in violation of your religious belief? But really just a sincere belief is all you need for a religious exemption. Yeah.
I want to remind people who this podcast is sponsored by, and it is sponsored by the Wellness Company. And then I'm going to play a clip. I'm going to play a clip of President Trump praising Pfizer, and what I specifically want you guys to do here at a moment is look at RFK Jr.'s face as this is going down in the Oval Office. But before I do that, again, I told you about the parasite cleanse. I want you to think about this is affecting many more people than you think. I've been doing a lot of research on parasites. That right there is a parasite in raw salmon at the grocery store. Literally, I eat a lot of sushi, which is why I thought I was affected by parasites, why I went on that total detox, the parasite detox. You can get it from the Wellness Company. As I mentioned, sold out 3 times. Mebendazole and ivermectin, totally approved for human use. twc.health/grant. Use that promo code GRANT for 10% off. Just go fill out the form. And then what I would like you to do is go peruse the Wellness Company's website. I've been using the methylene blue. It's like a total energy and mind clarity booster. It's been great. that too, Bobby Kennedy got a lot of publicity using methylene blue, but they've got probably the purest form of methylene blue available on the market today. And then there's the Spike Detox. If you took the vax and regret it, I urge you to go to the wellness company's website. Look at the Spike Detox. It really has been proven to work well about getting the spike protein out of your system. twc.health/grant. Again, use that promo code GRANT for 10% off. All right, we're talking with Dr. Ben Tapper. Oh, excuse me, Dr. Tapper. He is the director of epigenetics at the Wellness Company. All right, Dr. Tapper, I want you to watch this because I used to play a game with a buddy of mine. We'd watch sports, specifically the New York Knicks in the 90s when I had great hopes for them. And we would say ISO Charles Barkley or ISO Patrick Ewing, and we would just watch the action of that. And it was actually pretty comical when you do that, watching a sporting event. Well, I would like to play this game, and let's ISO Bobby Kennedy Jr., all right? He's on the left side of your screen here.
Thank you. I'm curious, where are the other companies other than Pfizer? Are you expecting them to come along later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID. He did a fantastic job with a lot of things. He's a leader, and Pfizer is right at the top. You know, it's there. Eli Lilly has been fantastic also, your friend, my friend. And they're all coming in over the next week. We're making deals with all of them.
So I got a body language guy that comes on my Real America's Voice show. I ought to do the body language on that, the looking around. I don't know. He doesn't look comfortable.
No, he doesn't. You know, I love to see or just know what he's thinking at that time, but I think his body language says it all. His facial expression says it all. I mean, I think he knows. I mean, obviously there's I don't know, how do you say it, but I think it's comical at this point. But, Bobby is definitely showing his frustrations with that statement. Pfizer's at the top. Again, that's, but again, what's the play here with Trump? It sends out mixed signals in my book. I
worry it was literally a marketing ploy. That the COVID vaccine, nobody's taking it. So the president says, all right, I'll put it out that I took it, and Pfizer gets a bump and people taking the COVID shot. I don't think it's going to work with the MAGA crowd, though. If anything, the liberals are doing the exact opposite of what Trump does. If Trump takes the vaccine, every liberal is going to stop taking the vaccine.
Right.
Maybe that was the ultimate goal. All right, let me play this for you because President Trump put this out, which shows you I think, look, President Trump can't be responsible for everything he puts out on social media. There's people in the teams. And I think the White House may be split on some of these issues because just a week or two before Pfizer comes into the Oval Office, before he takes the COVID booster, he puts this out on True Social.
Show them the thimerosal bomb, which we keep in a metal container because we're a little afraid of it, and it's a very fine powder.
This is thimerosal, which is labeled very toxic, has cumulative effects, can cause damage to the kidneys, to the respiratory system, skin, to the nervous system. It specifically warns on here that it can cause reproductive and developmental toxicity, meaning that it can cause things like autism and other neurodevelopmental disorders. This is immensely toxic stuff.
And it's in vaccine.
And this is what's in the vaccine.
It's important to realize we're talking about a whole range of products. Vaccines are a big one because, of course, you're directly injecting it. For example, this is tetanus vaccine. This one expires, it's a little outdated now, in 2007. Here's the thimerosal. 1 to 10,000 is a preservative. Perhaps the biggest one in the U.S., at least, that's for exposure to mercury is the influenza vaccine. Influenza vaccine is now recommended for all pregnant women, all infants, all children on a yearly basis. You're supposed to have last year's influenza? Understand that thimerosal is not added at the end. It's not like, well, that factory next year can make thimerosal free. Thimerosal, you either have to have a thimerosal free factory or you have to not have one. They add thimerosal at each step because the factory is not clean and not sterile. So you either have to have an expensive sterile factory where you don't need thimerosal, or you have to have one that produces thimerosal. It's going to need thimerosal or something the whole time. It needs to be stopped.
This is the influenza vaccine from Adventist Pasteur, their flu zone. thimerosal, 25 micrograms of mercury per dose.
I'd like to point out that a lot of people didn't know, and I'm one of them. I've given 2,000 RhoGAM shots. I've been in vaccines for 35 years. I didn't know that RhoGAM had thimerosal in it, so I think a lot of the doctors were unaware. They were unaware that even the word thimerosal meant mercury.
All right, Dr. Tapper, a lot to unpack there because, one, there's the fact that on September 8th, Donald Trump puts a Truth Social post out with that. They're all poison, is what it says.
Right.
Then he ends up taking a booster shot. So there's that aspect of this. But then there's also the aspect of this thimerosal. Do you know about it? And I will say, I've talked to wellness company doctors, including people like Dr. Victory and Dr. McCullough, who said, I was not on the anti-vax train for a long time until COVID came around and realized how crazy, corrupt, and dangerous the whole situation was. I think there's a lot of doctors out there like that.
100%. I mean, the studies have been out there though, Grant. I mean, there was an EPA chart that talked about how the thimerosal and flu shots alone, they mentioned pregnant women. Well, the baby inside the womb, that means that if you get a flu shot in utero, which means vaccination while you're pregnant, that baby is going to be exposed to 200 times the safe limit of the EPA max allowable mercury that's considered safe. So 200 times. So what is that going to do to that baby from a neurological standpoint? It's going to cause delays, degeneration, demyelination, all these other disorders that are occurring. And you're seeing that. I mean, if you look at the 1980s, right? Look at the 1980s and look at the vaccine schedule has skyrocketed. Look at the autism, the amount of autism. It has skyrocketed. In fact, if you look at the autism rate since 1980s, it used to be 1 in 10,000. Now, even Trump said it's 1 in 10. That's over a 30,000% increase in autism since the 1980s. They talk about how, it's autism is the diagnostics is better for autism. Are you kidding me? There's no lab test. There's no urine test. There's no brain scan. There's no genetic marker test for autism. It's based off of a behavioral analysis. So you're telling me that the behavioral analysis has improved to justify or equal over a 30,000% increase in autism? Get out of here. It's the vaccines. And again, the thimerosal is ethyl mercury. They say it's more, you can digest it better or the body can handle it better, but it's absolutely so toxic. And there's 25 micrograms, and the EPA has stated that only 7 micrograms is a safe allowable amount for the human body for an adult.
So without getting too into the weeds here, is this a preservative or is it designed to send the immune system into some kind of flux?
Well, a little of both. It acts as like a sanitizer or like a sterilization unit agent, and so that's why they use it. If you watch that video very closely, he said, you have to have a sterile factory, or you don't. These factories aren't 100% sterile. That's why they use thimerosal as a sterilization factor in these vaccines. But it is a very, very powerful, immensely dangerous neurotoxin. That's what it is. It's 49 or 50% mercury, and so it's something that we need to get out. And I would never inject that. We use it for in a lot of these flu vaccines and other vaccines in general. And most vaccines have it. It's either used in the production or manufacturing of all vaccines. So it's almost impossible to get it out unless you have a factory-free, thimerosal-free factory.
I've seen more and more evidence that the flu vaccine does nothing now, that it isn't working, and at best, it's like effective 30% of the time, something like that. Just doesn't seem to be the risk. And I'll ask you, for a guy like me, I'm 56 years old, the shingles vaccine, is it worth taking the shingles vaccine?
I don't believe there is a safe vaccine. I'm on that fence, but I think that, again, treating the immune system, understanding that God made the immune system, to be well, to overcome disease. And I believe that our body's ability to overcome a lot of these diseases is far greater than our government has permitted us to believe. So giving the body what it needs, especially when it comes to shingles, make sure that you're, moving away from toxicity and deficiency into purity and sufficiency. And we do that with good supplementation, treating the body well, giving the body what it needs, and focusing on building that immune system. And we can be well. And I believe that you won't get shingles. Yeah. So I think that there is a correlation too with vaccination of chickenpox and then your increased rate of shingles.
Yeah, interesting, fascinating stuff. I'll play you one more clip because we were talking about Dr. Oz and this meeting at the White House and all these things. And Glenn Beck had Dr. Oz on, and he literally asked him the question that we've been asking today. Take a listen.
Why Pfizer, for the love of Pete? Why did you have to start with Pfizer? Pfizer just has that bad COVID ring to it. Are they the only ones that are going to do it?
Oh, not at all. In fact, we have another company next week, one the week after, another one the week after. We have them all coming in. Pfizer is a bellwether. A lot of the other pharmaceutical companies look to it for guidance and leadership. Its CEO, Borlia, which that's his image right there, is a leader in the industry. And so when Pfizer was willing to come into the Oval Office and bend the knee and tell the president they understand why he feels so strongly about MFN, and they get the joke and they understand that they need to change their practices. And if we're willing to do what's required to make global pricing fair, it's going to work. Then it sends a signal to every other pharmaceutical industry player that this is the way it's going to have to be. And you know what? It's working. They're all coming in. They were coming in anyway, but now they're rushing in to get involved in the president's program. Our goal is to get every drug possible. We want 95% of all drugs sold in America to be at most favored nation pricing by the time the president has done this wonderful 4 years.
All right, so most favored nation pricing, that's really what the press conference was about, or in the Oval Office, that news gathering. So America gets access to some of the best price, as we should, because we set the tone for everything when it comes to pharmaceuticals in the world. There is a benefit to lower pharmaceutical prices. I'll give you that, and I do think that President Trump's ultimate goal is to get those costs down for American citizens, Dr. Tapper.
Yeah, I mean, I think that's great. I mean, right now you have to understand that Americans, we make up 5% of the world population, but yet we take in 65 to 70% of the world's pharmaceuticals. So it makes you also your head spin, because why are we taking that many pharmaceuticals in the first place? But what does that tell you about America's health? We are dealing with chronic disease, and I think that's really the tip of the spear there. That we need to combat that chronic disease. But lowering drug costs, I think, is a phenomenal thing. I mean, every 30 seconds, someone goes bankrupt due to medical bills that they can't afford, and that even includes the people with the Cadillac health plans. So our healthcare costs are skyrocketing. So lowering that drug cost, I think, is a great win. But also, I think we need to break up the stronghold that a lot of these insurance companies have on our healthcare systems, because they really dictate our healthcare costs as well. So breaking up that whole monopoly with the insurance companies and their stronghold on our healthcare systems, I think, is Trump's next step, and I hope that's his next step anyway.
Yeah, I hope you're correct about that as well. I've told the story many times. I had a pinched disc in my neck, and I was in so much pain, a herniated disc, that I didn't know what to do. I ended up going to the emergency room. I called first. I said, I need an MRI. Can you give me an MRI? They say on the phone, yes, we can. Well, then I get there. They can't give me an MRI. I need a doctor to prescribe it, and the emergency room doctor's not going to do it. I get nothing. I got a shot that helped with my pain a little bit. I get a bill for $5,000 for my emergency room visit. Now, luckily, I have a national platform, and I start blasting Baylor Health Scott White in Dallas, a big hospital chain, and I get a call from the vice president of customer relations to say they're going to waive my bill. And I'm like, I don't want you to waive my bill just because I'm me. I want you to waive the bill because you did freaking nothing for me, right, and you didn't do what you said you were going to do, and then you tried to hit me for $5,000. To their credit, they did waive the bill, but not everybody can call the hospital up like I can.
Right. I mean, you see that over and over, Grant. I mean, I did the same thing. I had a shoulder injury. I went to the ER. They x-rayed my shoulder. I looked at the x-ray. I said, I have an AC separation. And they said, you just jammed it. And they sent me in a sling. They sent me home. Well, I went to my own clinic, took my own x-rays, and I said, I have an AC separation. I confirmed it. I called down there. I said, you guys misdiagnosed my shoulder. And they sent me a $3,600 bill. And I said, you guys misdiagnosed me. And so then they actually waived the bill for the same thing. Now, I'm a rarity because I can read my own x-rays. But again, how many other people just go in for an x-ray, go home with a sling, and then boom, a $3,600 bill?
Yeah.
And this is the real problem. We have to have, again, it's cash discounts or different things, but the insurance companies are really dictating the prices.
Yeah, they really are. Dr. Tapper, it's always good to see you. I appreciate you coming on. I always enjoy our discussions. And keep up the fight, my man. You do such a great job. I'm proud to have you on the podcast, as always. Thank you.
Yep. Thanks, Grant. God bless.
Absolutely. You too. And that is the great Dr. Ben Tapper with the Wellness Company. And again, this is what you get with the Wellness Company. You get these kinds of doctors who, one, can critically think. They are not sheep. And you may be surprised, but there are oftentimes disagreements among the Wellness Company doctors. But guess what? They talk it out as well. They'll come on and make their case. They're not afraid of their stances. And they trend set. And that's what we want. We want people who are bold leaders, and that's why I'm proud to be associated with the wellness company. TWC.health/grant. TWC.health/grant. Use the promo code GRANT for 10% off, from the parasite cleanse to the prescription medication kit. And oh yeah, don't forget, this is the field kit. There's an EpiPen in here as well. This is the mother of all prescription medication kits. I've got it all, and I'm happy to, because I want to be prepared. TWC.health/grant. Use that promo code GRANT for 10% off. If you're watching today, folks, on whatever platform, please subscribe to the platform. That helps us spread the word. And then share the podcast everywhere you can. We're here basically Monday through Thursday at 12 o'clock Eastern time, around 11 o'clock Central time, give or take 10 or 15 minutes. Stinchfield 1776 for me on all the social media platforms. Stinchfield 1776. Stinchfield's Army rolls because of all of you. We'll see you on the Real America's Voice show tonight at 7 p.m. Eastern time. Thanks for watching, everybody.